As an administrator over the past few years, how would you view accommodation, doctors' accommodation as a factor to the outcome of health indicators, the performance of the healthcare facilities in the country?
Thank you. Thank you for that question. My general perception as per my experience, uh, like shortage of doctors' houses referred to as limited or a complete lack of proper residential accommodation for medical doctors working in hospitals and rural facilities. It means that many doctors either live in overcrowded conditions, rent privately at high cost, or are forced to travel from distance from where they live um, to their workplace. So it's like without a doctor's house, no service, okay? Especially in rural areas. With my experiences at many health facilities outside rural areas, I see that the problem is doctor's house. They have everything. When you have no doctor's house, there's a problem. There will always a problem. Okay, so this problem is very severe in rural areas, in remote areas because many health facilities lack basic housing altogether. So doctors posted their offer, posted there. So when they were given a position out, for example, in a rural facility, example in Sundown, when they were given a position at Rayu District Hospital, they left quickly. They went there, I think 1 or 2 months or 2 weeks, they leave again, back to the town because of poor living condition. Okay? So in urban areas, although some accommodations are available, it is usually inadequate because doctors face high rental. Okay? Rental cost make it still a serious issue. Even in rural area, no cost. But when there is no doctor's house, they all run away back to urban areas. They face the same problem. Okay? The cost of renting a house is very high in town. And nowadays, doctors are renting houses. Okay? So it's a big problem.
In terms of the, since they are because of the living conditions, poor living conditions, and high rental payments, has that really got to do with some their performance in the hospital and the outcome in the patient service? Like, how do you measure those?
Okay. Impact on the doctor's performance. Okay. So when doctors lack proper housing, their moral drops. Okay. They feel unvalued, okay, unsupported, which reduces the job satisfaction. So this can lead to stress, burnout, lack of motivation to serve. So, like doctors live far from health facilities, may arrive late, okay, be unable to respond to emergencies quickly. They face fatigue from duty travel. Poor housing condition also affect their mental well-being. Okay, so when the mental well-being is affected, the patient suffers. Okay, so doctors are very important. So when you want to manage a health facility, or doctors must be a priority. Accommodation is very important. When for example, when in Sundown, my experience when I went down there, we have a doctor's house, but no doctor. And I personally ask questions. Why is this no doctor? Okay, I went to the CEO, now the current member, current health minister, uh, Elias Kapovaran. I went to him ask why doctors are not coming to ask that why is this hospital? And he said the problem is housing. Housing plus the kids' education is very important. Car, these are the basic things that doctors need, and equipment in the facility. When there is no equipment to operate, there is no basic or minor theater. Doctors, they are wasting their time sitting there. They need equipment to work. Okay? There are three things: accommodation, kids' education, and equipment at the facility. These are the things that doctors need. When they have this, they'll settle. Otherwise, no. So, yes, the situation strongly influence retention. Many doctors leave rural areas because of poor housing. They preferring go back to town, big hospitals, or they will go to private hospitals, mining, especially mining, PIH, private, because because of accommodation, because of they are highly paid, they have everything. So yes, the impact on doctors' performance is very depending on that activities.
Coming up to our last question, as a former administrator, what is your advice to the health administrators in terms of planning infrastructure development, especially in sectors housing? How would you advise?
Okay. My advice to especially health management, if you have a chance to manage a facility, or to all the health professionals, health managers, my solution or the recommendation to this problem, prioritize funding for construction and maintenance of doctor staff. This is very important. That's one, you prioritize infrastructure funding. Number two, you must have a private partnership arrangement. Okay? Health cannot work alone if there is no partner. That's why you need a partner. Okay? PPP is very, very important. And number two. Number three, allocate housing allowance for doctors in rural areas. Okay? This is very, very important. In rural areas, especially the rural, district hospital, you always, and it's a must, you have to provide allowance, doctors' housing allowance, and engage local community to support. Okay? These are my three, very, very, not three, but four very important things. My advice to health managers. One, I repeat again, one, prioritize funding for doctor's house for maintenance. Number two, you must have a private partnership arrangement. Okay? There are many donors around. You have to connect with them. So they will help you build houses. Okay? Allocate funding or allowances for doctors. Okay? Engage local communities to support the doctors. Okay? And others like education for their kids, car. When you see doctors have all these things, they will perform to the best. Okay. Did I answer every question?
Thank you. Let us go to the end of the interview. And thank you so much for your time. I appreciate your interview. Thank you so much.
Thank you.